Hey everybody, I am Carolyn the educator. I am a homeopathic practitioner and I am studying for my doctorate degree in homeopathic medicine. My specialty is biomedicine. I am a licensed healthcare practitioner and welcome to the webinar, everybody. And let me know if you can see my screen that I'm going to share with y'all. Let me know when you can see it.
I can see it now.
Y'all don't see it?
I see it.
Okay.
I see you.
All right. Dr. J, do you see it?
Yes, ma'am.
All right. What natural medicine revealed that others hide about prevention? We're going to be exploring the hidden truths of preventive health, and it's all about healthy living. And we're going to start with the objective of this presentation, and that is to understand the preventive benefits of natural medicine to uncover what is often overlooked or hidden by mainstream resources. Now, I will say this, if you do not have an ink, pen, and paper at this time, I'm gonna give you like 1 second to get ink, pen, and paper because there's some things you're gonna wanna write down.
Okay.
So if you don't have ink, pen, and paper right now, please get it.
Okay.
Let me know when everybody ready.
I got mine right now. I'm ready.
All right, so what is natural medicine? It is an approach to health and wellness that emphasizes the use of natural substances and holistic practices to promote healing, prevent illness, and enhance overall well-being. It contrasts with conventional medicine. Also, another term for conventional medicine is allopathic medicine. By focusing on the body's inherent ability to heal itself and maintain and balance throughout natural means. Now, as I go along in this presentation, I want y'all to think about several things, and that is, what is your current health condition? And who else do you know that suffers from chronic illnesses? And do you or they know what the root cause is, or do you just know the symptoms of the chronic illness and or the disease or the pathology? Y'all good?
Yep.
Okay. Second, this is interactive. So I'm gonna be asking some engaging questions. Y'all good with that?
Yeah.
All righty. Key components of natural medicine. Herbal remedies are plant-based treatments used to treat various ailments. They are derived from herbs, flowers, roots, bark, seeds, and leaves. And what's not in here is also fruits. Herbal medicine is one of the oldest forms of treatment in human history and is a central part of many traditional healing systems, such as traditional medicine and Ayurvedic. Now, I want you to think about this. There was a time in our history where there was no physicians, none. Who was doing the healing and helping people with their illnesses? And where was they getting the medicine from? Do anybody know?
I know.
Jackie?
They was growing the medicines in their own yard.
Say it again, Jackie.
They were growing the medicines in their own yard.
Yes. Until like the 1800s, when it was these 5 families that we all well know and who they are, that's very big in the pharmaceutical industry, but they also created the first school for physicians, and that weaned out anybody who was practicing medicine without a license. Participation is greatly appreciated. Which herb do you think everyone should have in their kitchen for health purposes? And what I'm going to do is I'm going to name these herbs. Let me tell you what they are. The first one is echinacea. Echinacea boosts the immune system, but also helps with infection. This one is ginger. Ginger is used to treat nausea, digestive issues, and inflammation, but it's also used for many types of digestive issues such as irritable bowel syndrome, IBS. The next one is St. John's wort. This is used to treat depression and anxiety. So how many people do you know or know of that takes prescription medicine for anxiety and or depression. And this last one is
What's that?
turmeric. Turmeric is known for its anti-inflammatory properties. So let me give you an example. There was a study done. It was a blind study and a control study. The control study knew that they was getting turmeric in their food. The blind study didn't know. And what the researchers did was they studied these individuals for a week. And what they did was for breakfast, lunch, and dinner, they would add turmeric to their food. Then they would take their blood and test it, and they would look at the DNA of the blood. So they did that before they started the study with the turmeric, and then after a week, they studied the blood again. And what they found was before the study, people had breaks in their DNA. After the study, which was a week of the individuals eating the turmeric in their food, the breaks was no longer in the DNA. So turmeric is very known for its anti-inflammatory properties. Now that you know a little bit about each one of these, which one do you think should be in your kitchen every day and why?
Carolyn, I just got ginger and turmeric. What are the other two?
Which one don't you have?
I got ginger and turmeric. I don't have the one. You had one start with
Okay,
an A. What is
echinacea.
that? Yeah.
This was echinacea,
Spell it?
plant-based. Echinacea boosts immune system and helps fight infection.
How do you spell it? It's on there? I don't see it.
It's ENCINACEA.
Okay.
And what's the other one you don't have? Turmeric or
I
St.
got
John's wort?
I got ginger, turmeric, and now I have that one. Is it one
St.
more?
John's wort. Right. Are y'all familiar with St. John's wort? Anybody? Regina, I know Dr. J you is because we study the same thing.
Yes. I was gonna say though, like the other thing that I definitely try to keep is cinnamon.
Okay.
Yeah, because I mean to me that's right up there with the like with the turmeric. But I mean it has the health benefits, it helps lower blood sugar and all that stuff, which you know. But I think like when it comes sometimes like ginger tea, because I'm 32 weeks pregnant and had some serious morning sick like, and I say morning sickness, but I've been like dry heaving and nauseous like this entire pregnancy. But ginger tea was my go-to, and then like adding some cinnamon to it just kind of helped with that sharp spice taste, you know, that it has. And then of course honey, lemon also.
Okay.
Yeah.
All right.
But
So
this
we're
is
familiar with that.
great. Yeah.
Nutritional supplements. Nutritional supplements are substances that provide essential nutrients to support overall health and address specific health concerns. These may include vitamins, minerals, amino acids, and enzymes either derived from food sources or they are synthesized, which means that they are synthetic. There's nothing natural about them. Natural medicine practitioners often use supplements to correct nutritional deficiencies, enhance the immune system, and promote overall well-being. And we're going to get into more of the natural medicine part. When choosing a supplement, do you prioritize natural or synthetic options and why? Somebody.
I prefer natural stuff because natural stuff may ward it off or get rid of it. If you just start taking medicine, it's just an ongoing thing, in my opinion.
Okay. Regina?
I would prefer natural as much as possible. I know sometimes when you have certain deficiencies, um, sometimes the natural option may not be available. And so then it may be necessary to go for a synthetic route, at least for a
Okay.
short period of time.
Right. And watch for it if we're doing the synthetic route, just pay attention to what your body's telling you as far as the side effects.
Right.
I'm going to start with holistic practices. The holistic practices in natural medicine involve treating the person as a whole rather than focusing solely on the disease or the symptoms. These practices address mental, emotional, spiritual, and physical health. Common holistic practices include acupuncture, homeopathy, which is my specialty, and I think Dr. J's too, chiropractic care, and massage therapy, which is another one of my specialties. Holistic medicine also encourages lifestyle changes, such as adapting healthy eating habits, regular exercise, stress reduction, techniques such as meditation or guided meditation, and mindfulness practices would be yoga or Tai Chi. The contrast with conventional medicine, also called allopathic or Western medicine, is based on scientifically tested methods and clinical trials, focusing on diagnosing and treating diseases primarily through pharmaceutical drugs, surgery, and other medical interventions. So I'm going to give you this example. I'm not going to mention the hospital, but I will say this. During a certain time, and this might happen at a lot of hospitals, but during a certain time of year, during the holidays, mommies, I'm gonna say parents, if they're short on cash, they will, and their child is sick, so keep this in mind, there's children involved. What some hospitals do is they will offer the parents or the parent money to use their child for research. And they are not paying the parent the amount of money you think they should be paying it, because they only paying $75. And the parents are agreeing to these healthcare professionals to use their child as guinea pigs to hopefully find a cure for the disease that that child may have. Y'all are aware that this is going on, right?
Yes.
Regina, why you looking like that?
I didn't realize it was going on. That's pretty sad.
It's you know what? It's very sad that these parents are even agreeing to accepting money so that these healthcare professionals can use this child as guinea pigs and do testing on them just to see if they can find a cure for what this child has. It's very, very sad. So when you hear me say focusing on diagnosing and treating diseases primarily through pharmaceutical drugs, surgery, or other medical interventions, with these babies, it's medical interventions. They do it with adults, but with adults, they may offer $150 for a study. And then they have to sign a waiver that if something goes wrong, that person cannot sue the hospital or the people that's doing the research. The highest I've seen was $1,500. But no matter what the money is, it's not worth putting your body through unknown research studies and you don't know what the outcome is going to be. That makes sense?
Right.
Key differences is going to be: one, approach to treatment. Natural medicine seeks to address the root causes of the illness, often aiming for long-term balance of the body's systems. Treatments are often preventative, aiming to support the body's natural ability to heal itself. Conventional medicine primarily focuses on alleviating the symptoms or eradicating the disease itself using medications or surgery. The goal is typically immediate symptom relief or a cure. The second key difference is medications. Natural medicine uses plant-based remedies, minerals, and other natural substances to restore health. These are often minimally processed and may have fewer side effects because it is primarily plant-based. Conventional medicine relies heavily on pharmaceutical drugs, which are synthesized chemicals tested for safety and efficacy, but often come with side effects. Have y'all noticed that there's a lot of commercials that has new medication for specific chronic illnesses, and they do mention the side effects, and it's constantly being pushed? Do y'all watch TV?
Not like I used to, but I don't look at commercials. I really walk out myself. But I do see a lot of stuff. Mhm.
Philosophy, natural medicine views health as a balance of body, mind, and spirit. The goal is holistic wellness, not just the absence of disease. It emphasizes the patient's role in healing through lifestyle changes and personal responsibility, meaning taking control of your own health. Conventional medicine focuses on scientifically proven methods to diagnose and treat disease, viewing the body more like a machine where parts, organs, and systems may need repair or replacement when malfunctioning. The diagnostic tools, we're still on keys. The diagnostic tools, natural medicine relies on a combination of physical assessments, the patient history, and sometimes energy-based diagnostics, such as pulse diagnostics, which is practiced in traditional Chinese medicine, or iridology, which is with the eyes. Conventional medicine uses high-tech diagnostic tests, such as CBC tests, MRI scans, CT scans, and other imaging technologies to pinpoint a disease, such as CT scans is going to be able to tell if a person has cancer or not. Prevention versus cure. Natural medicine prevention is a primary focus. Practitioners encourage their patients to maintain wellness through nutrition. I don't like this word, but a lot of people like using diet. I prefer the word nutritional regimen. Supplements and lifestyle changes reduce the likelihood of chronic disease. Conventional medicine, prevention plays a role, but the focus is more on curing, on managing diseases after they occur. Where natural medicine is proactive, conventional medicine is reactive, often through medical interventions like medications or surgeries. A complementary approach. Today, many practitioners and patients use an integrative approach that combines the best of both worlds. For example, a patient with cancer might use chemotherapy, which is conventional, and it's okay, while also taking herbs or practicing acupuncture, which is natural, to reduce the side effects and support overall well-being. However, when it comes to specific diseases or specific chronic illnesses, some herbs may have a drug interaction. So what I normally tell my clients and my patients, when it comes to herbs, I need to know what medication they are on. And based on the medication, I need to find a herb that can benefit them for their condition, but at the same time, it does not have a drug interaction with the prescription medication they are on. Y'all get that?
Yeah.
Okay. Regina, you got it?
Yes, makes a lot of
Okay.
sense.
Okay. Both systems of medicine have their strengths, and using them together can provide comprehensive care to treat both the disease and the whole person. Now, what's the biggest advantage you see in using natural medicine over conventional methods, or using both? Second question, which do you believe focuses more on prevention, natural or conventional medicine? And how will this impact your health decisions? Who wants to go first with that question?
I can go.
Okay, Jackie.
Be more prevention. I think natural.
Okay.
I think natural would be the best because it's gonna get to the root
And the
of the
second
problem.
question?
And the second one says what how will this impact your health decisions? Oh, because if I have something like my cholesterol is creeping up and I have opted not to take medication, I think if I do natural stuff, it's gonna stay away. But if I start taking medicine, I'm just controlling it with medicine.
Right. The other thing, because your cholesterol is starting to
Creep up.
up on you, as you say,
Mm-hmm.
also take a look at not so much as treating the symptom, but find out what the root cause, like what's causing your cholesterol level to go up. So you want to take a look at what is in your nutritional regimen, what is causing your cholesterol to go up, what is causing the plaque to increase, what is causing the diameter of your blood vessels to get smaller. So take a look at what's causing it, other than treating it, just the symptoms of having high cholesterol. Because if you can take a look at what you're doing that's causing your cholesterol to go up, you'll be in a better position other than taking prescription meds. Make sense?
Yeah, it does.
Okay. Dr. J, you want to add anything to that?
No, well, no, I mean, I guess maybe, I don't know. I was gonna say, like, obviously I think natural medicine is definitely focused more on prevention, than conventional. And I think one, I mean, you don't need a prescription for natural medicine. Like that's one, right? Like there are certain homeopathic medicines that you do need a homeopathic or naturopathic doctor to be able to prescribe to you, more or less. But like you can go get your own cinnamon, you can go pick your own dandelions and dig out your own dandelion root and make tinctures and things like that on your own. So I think that's a lot easier. Plus, like when there was Miss Jacqueline speaking,
Yes.
um, you made me think of, so I'm a psychologist, a developmental psychologist is the main thing that I do, but I do have a lot of background in homeopathic medicines just because I'm also a 100% disabled veteran and had to learn this stuff for myself. And one of the things that I found interesting recently is when we're dealing with patients who are on depression medications, there's something called tardive dyskinesia that they can get, or that they can develop, which is called TD,
Mm-hmm.
and it's tics that they can develop from the medication, from the depressive medication. What I found interesting is that rather than changing their medication or trying to get them off of the medication, um, the medical field has found a way to just medicate the tic that's being caused by the medication. And so I
Yeah.
often refer to that as medication stacking, right?
Mm-hmm.
Because that's what happened to me. I got one medication, it caused a symptom, and then they gave me a medication to help with the symptom rather than taking me off the medication and trying something else. And so I've lived that life. It sucked. I was taking over 30 pills a day when I
Really?
was 27 years old.
Oh my
Yeah.
God.
And I was like, this is not the way to live. Like, this is not life. I don't remember, like, the first year after I got out of the Navy, I don't remember. Like, it is a giant blur, which is terrible because I had two young kids, was working in the mental health field, couldn't tell you much about that year.
Mm.
And so
So
definitely,
what would you recommend for Jackie other than what I said?
for that specifically, I wouldn't know. Um, off the top of my head at the moment, I wouldn't know. That would be something I would definitely want to do research on.
I can tell y'all what I've been taking. I was taking milk tinsel, a
Milk
herb.
thistle is good.
Oh
Somebody
yeah.
tested that and that went down. But this year when I went back, I knew I hadn't been doing what I had usually been doing for the last 6 months. So I was not surprised when I took my last blood work a couple of weeks ago that it had risen a little bit again because it had went down. But my doctor told me one time looking at my results or something like that, whatever they look at my blood work, he said it wasn't nothing I was doing at that time. He said it seems to be hereditary. And I think it is.
Okay. The importance of prevention is a crucial concept in healthcare, and it focuses on taking proactive steps to avoid the onset of diseases or to minimize the impact. Preventive health measures empower individuals to maintain and enhance their well-being, reducing the need for more aggressive medical interventions down the road. And this is why prevention is so important. The importance is, one, the quality of life. people are less likely to experience chronic pain, loss of mobility, or mental health deterioration that could lower their quality of life. Cost efficient, the cost of hospital visits, the surgeries, the medications, and rehabilitation, all of which can be avoided or minimized with early preventative actions. Empowerment and control, taking preventive measures enables you to take control of your own health. This proactive approach leads to increased awareness, better choices, and a feeling of empowerment, knowing that you have influence over your well-being. The importance, we're still on the importance, reducing the risk of chronic diseases, leading cause of death and disability worldwide. One of the most significant benefits of prevention is its ability to reduce the risk of developing chronic diseases, meaning proactive. Cardiovascular diseases, preventive measures, regular exercise. A balanced nutritional plan that's low in sodium and trans fat. Avoid smoking and managing stress can significantly reduce the risk of heart disease and stroke. Now, my question, because it says sodium and trans fats, who actually reads the labels other than me, only because I'm a little nerdy, reads the labels on everything you buy, especially when you go into the food market, just to see how much sugar and how much sodium is in it?
No, we should, but I don't.
Is that nerdy of me because I do that? I think everybody should learn how to read the labels to know what's going into your system. Because there's things that our government, our FDA allow to be put in our foods or put on our skin, meaning the ingredients, knowing that it can cause chronic illnesses, diseases, and wreak havoc on the human body. So it is important to know how to read the labels of how much sugar and how much sodium and which dyes is in the food, because there's certain dyes that is carcinogenic, as well as there's certain foods that is carcinogenic. Y'all good?
Yeah.
Statistics, according to the World Health Organization, 80% of premature heart disease, stroke, and type 2 diabetes cases can be prevented through a healthy lifestyle. Diabetes preventive measures, maintaining a healthy weight, consuming a balanced nutritional plan with controlled sugar intake, and engaging in regular physical activity can help prevent type 2 diabetes. I'm gonna use me as an example with this. So one day, this was several years ago, I was on the Boston Market kick, and the only reason why I was going to Boston Market is for the sweet potatoes, the candy yams. And I was in there every day for 2 weeks. And my appointment came up for my doctor's appointment to draw my blood work. And when I went back to get my blood work, he says, you know what? You're pre-diabetic. I don't know what you're doing, but you need to stop. I knew what I was doing. I was in Boston Market for 2 weeks eating it up. And when he told me I was pre-diabetic, I didn't go back in Boston Market anymore. That was enough to make me stop. Now I go to the market, I buy me the candy yam sweet potatoes, I bake them and put cinnamon on top and call it a day. So it's certain things that we can do to prevent from getting or being a diabetic. Type 1 diabetes, that's congenital. Those are babies. That is not reversible. Type 2 diabetes is adults, 14 and up. That's reversible. That's something that we can control. People don't have to be diabetic. They just have to change what they're putting into their temple. Statistics, CDC notes that more than 1 in 3 adults in the United States have prediabetes, a condition that can lead to type 2 if left undressed. However, weight loss and physical activity can cut the risk of diabetes by more than half, according to the CDC. Cancer preventive message, avoiding tobacco, maintaining a healthy, rich nutritional regimen and antioxidants, engaging in regular physical activity, limiting alcohol practice, and safe sun exposure can prevent various forms of cancer. And there's many, 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 many types of cancer. Now, when it comes to cancer, I must say this. There are, and I said this earlier, there are certain foods that are carcinogenic. There are food dyes that are carcinogenic. There are products that we put on our skin that is carcinogenic, but that's for another presentation. But I wanted y'all to know that. Y'all all right?
Yep.
The importance of prevention and well-being, improve overall well-being, pay attention to prevention, which is proactive, take care of your physical health, take care of your mental health, take care of your emotional health. All of this can lead to a better heart, stronger muscles, and increased endurance for what you do in your daily, everyday activities, your ADLs. Your mental health, you want to manage stress. One way to manage stress is don't let people get on your nerves. If you know somebody who is constantly working your nerves, as we say in the military, DX them, eliminate them, so you can have peace of mind. The other thing you can do is meditate, pray more, stay socially connected, and practicing mindfulness. This prevents anxiety and depression. People who are highly stressed leads into depression. And some people get stressed over little things that they shouldn't get stressed over, and they end up on medication for anxiety and depression. Emotional health, managing emotional stressors before they escalate, emotional resilience supported by therapy and self-care routines such as meditation and Tai Chi, and a strong social network. Reduce the likelihood of burnout, depression, and other emotional issues. Preventive care saves lives, according to the CDC, adopting 5 simple lifestyle habits like not smoking, doing some regular physical activity, become a line dancer like me, just dance your heart off until you can't dance no more and your feet hurt. Have a healthy nutritional regimen. If you eat a lot of fried foods, try not to eat a lot of fried foods. If you eat a lot of starches, try to eliminate the starches or reduce the starches, because starches turn into sugar. If you eat a lot of junk food, just eliminate that altogether. All of those things will help. Moderate alcohol consumption. Be sociable with it. Could reduce the risk of premature death, 55% in women and 44% in men. This number is crazy, 55% in women. Chronic disease burden in the United States, chronic diseases like heart disease, cancer, and diabetes are responsible for 7 out of 10 deaths each year and account for 75% of the nation's healthcare spending. I will say this, when I was doing a study on what chronic illnesses and diseases are we as a culture of African Americans or Blacks, what's the highest? These right here, heart disease, cancer, and diabetes was in the top, along with kidney disease. Those are the top 4 when it comes to us. And a lot of people are being, a lot of us, as well as a lot of people worldwide, is being diagnosed with kidney disease and cancer, whether it's cancer stage 1 to cancer stage 4, or it's kidney disease stage 1 to stage 4. Any questions, anybody? Am I going too fast?
No, we follow. I'm following.
Okay, Regina, you okay? You kind of quiet.
I'm good. Just
Okay.
listening.
All right. If y'all have any questions, don't hesitate to ask. Preventive, I did that one. Prevention statistics, vaccinations as prevention. Childhood vaccines have been estimated to save 42,000 lives and prevent 20 million cases of disease over a generation in the US alone. Vaccination is one of the simplest and most effective forms of preventive care. Other examples of preventive care with allopathic systems, Western medicine, convention medicine, whichever term you choose to use, we use health screenings, we do immunizations, we do dietary changes because some people see a nutritionist or a dietitian, and an exercise regimen. What mainstream sources might overlook, meaning mainstream doctors, they focus more on symptoms versus the root causes. Conventional medicine focus on symptoms. Natural medicine focus on root causes. Mainstream medical practice often prioritize the management of symptoms rather than addressing the underlying causes of health issues like I had did with Jackie. This approach can lead to temporary relief, but may fail to prevent the reoccurrence of health problems if you just keep addressing the symptoms. Symptom management, conventional treatment focus on eliminating symptoms through medications, as mentioned earlier, surgeries, or other interventions. The thing is, I'm gonna give you an example. A patient that has chronic pain, they will be prescribed painkillers without even knowing what the cause of the pain is. That cause could be any type of muscle imbalance that's causing them to have pain, or it could be a nutritional deficiency that's causing them to have pain. Neglect of underlying factors. Those conditions like hypertension, diabetes, and obesity, they have complex root causes, but it's all about the lifestyle choices that they make, as well as environmental factors. Failing to address those underlying issues can lead and result to ongoing health challenges. Natural medicine perspective, emphasis identifying and treating, as I said before, root causes that will promote long-term healing and also increase the person's wellness. This is something you want to write down. What mainstream sources might overlook: symptom management, neglect of underlying factors, and natural medicine perspective. Let me know when I can go to the next slide. Let me know when I can go to the next slide, y'all.
I have it.
Virginia, you got it?
Yes.
Okay. All right. Case studies: herbal treatments for common ailments. Case study: echinacea for cold. Echinacea is known for boosting the immune system. Many individuals turn to echinacea to prevent or shorten the duration of colds. Remember back when the beginning of COVID, the Rite Aids, the pharmacies, they ramped up on echinacea tea, and you could go in the pharmacy and buy echinacea tea. Anybody remember that? Evidence: a review of multiple studies published in the Journal of Alternative and Complementary Medicine found that echinacea can reduce the risk of developing upper respiratory infections by up to 58%. Next case study, dietary changes for chronic conditions. Background, Mediterranean nutritional regimen characterized by high consumption of fruits, vegetables, and whole grains, healthy fats like olive oil, and moderate intake of fish and poultry. Fish, omega-3, and poultry has been associated with numerous health benefits. Evidence, a landmark study published in the New England Journal of Medicine demonstrated that individuals adhering to the Mediterranean nutritional regimen experienced a 30% reduction in cardiovascular events compared to those of low fats. Natural herbal remedies for prevention. These you want to write down. Turmeric, ginger, garlic. Nutritional adjustments for anti-inflammatory foods is going to be fruits and vegetables, healthy fats, and whole grains. Y'all good?
Yep.
All right.
Yes.
What physicians might not tell you, while many healthcare professionals provide valuable insights, there are important sides of natural medicine that may not always be emphasized in conventional advice, meaning when you're talking to your physician. The next slide highlights the unspoken benefits of natural medicine and discusses potential limitations of conventional recommendations. Now, I know with my primary care physician, I had mentioned something to him about a herbal remedy, and he was honest enough with me to say, you know, I don't know anything about natural medicine at all, because that's not my field, and I wouldn't be able to tell you. And what I asked him had to do with my spouse, because my spouse has cancer stage 4, but he also developed some other health issues. And little old me, because he's on all this medication, I refuse for him to have chemotherapy. I refuse for him to have radiation. I agreed to the immunotherapy. Now, based on his immunotherapy medication, and he developed some other issues, I knew that what I wanted to do for him to help him, I needed to talk to our primary care physician. And when I asked the primary care physician what I wanted to do, he said, I don't know anything about your expertise. I appreciate that, because he was honest enough to tell me, whereas I encountered a different situation with a different doctor for my husband, who was an Indian doctor, but she is a medical doctor. And because she couldn't make no money and prescribe the medication that she wanted to prescribe my husband, because I like, no, he not taking that. I like, is there any other natural thing you can prescribe him? And she's Indian, so I know she knows Ayurvedic medicine, but because she could not make more money off of the Ayurvedic medicine, she didn't want to help, because she wanted to push the prescription medication, and I was refusing it. So you have a lot of physicians that all they know is Western medicine, thanks to Big Pharma, because Big Pharma is the legal drug dealers. They're the head, they're at the top, because they're the ones that's manufacturing the medication, and they present it to these physicians and tell them, try this on your patients and get back with us. If you have not already seen the movie, I'm trying to think of this movie. It was a movie about one of the families that own the pharmaceutical companies. That was a movie. And if I think of the movie, I will share that movie with y'all. But it's a movie that y'all should watch. It came out about 4 years ago, but it still happens today because these 5 families still control the pharmaceutical industry. Unspoken benefits of natural medicine focus on wellness. Natural medicine emphasizes treating the whole person, the body, mind, and spirit, rather than just addressing isolated symptoms. Benefits: this holistic approach can lead to a more comprehensive health improvements, fostering a greater sense of well-being and resilience. Personalized care. Natural medicine often involves tailored treatments based on the individual's needs, their preference, and health histories. The benefit: the personalized approach can enhance the effectiveness of interventions as treatments are designed to align with unique circumstances of each individual. Emphasis on prevention. Natural medicine prioritizes preventive health measures, empowering individuals to take control of their health and reduce the risk of chronic diseases. This is very, 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 very hard, because even on my primary Facebook page, no matter how much I talk about people taking control of their health, they don't listen. And then when something happens, I get a phone call. Can you give me the information on what you said about peppermint essential oil? And it's like, be proactive. Benefits: by focusing on lifestyle changes, dietary adjustments, and natural remedies, individuals can promote long-term health and potentially avoid the onset of illnesses that require medical intervention. Now, you may say, Carol, well, if this keeps up, we're not going to be able to eat anything. Yes, you are. You just have to know what is causing the root cause of these diseases and these pathologies that can take you under. And you want to live a more healthier lifestyle. Connection to nature. Many natural remedies are derived from plants and natural sources, fostering a connection to the environment and encouraging sustainable practices. As Jackie said, before there was physicians, people was using the earth to help heal themselves. Benefits: this connection can enhance mental well-being and promote a holistic view of health that encompasses ecological considerations. And why conventional advice may be limited. Conventional advice is going to be limited because the pharmaceutical industry do not create cures, they create customers. It is a billion-dollar industry. Focus on immediate solutions. Conventional medical practices often prioritize quick fixes for symptoms, which does not address the root cause of the problem. The limitation can lead to a cycle of dependency on medication. You have some medications, that's addictive. Standardized protocols is another one. With the standardized protocols, conventional medicine is a standardized treatment protocol that may not consider an individual variation, such as what is their genetics, what is their lifestyle, what is their personal circumstances. The limitations with standardized protocols is a one-size-fits-all approach that overlook the needs of individuals and limiting the effectiveness of the intervention because it's standard. You have a cold, what is the primary medication that they give you? If you have a virus, what is the primary medication that they administer? If you have a bacterial infection, such as streptococcus, what antibiotic is they going to give you? Some antibiotics has gotten so good that they're resistant. The viruses is very resistant to the antibiotics, and they don't work no more. So those are some things to take into consideration. Then there's underemphasis on lifestyle factors, which means if there's an underemphasis on lifestyle factors, conventional advice is not going to sufficiently address the role of the lifestyle factor, such as what's the person's nutritional regimen? Do they exercise? What is their stress management like? limitations. If it's neglected, the critical size conventional medicine may miss opportunities is for the patient to make impactful changes to improve their health. And the thing is, I'm gonna ask y'all a question. When you see your primary care physician, is you asking them questions on everything they telling you? If they writing out a script, are you asking, why do I have to take this prescription? What's it for? And what is the side effects? I ask my doctor that all the time. You just can't prescribe me anything and think I'm going to take it. I want to know, why am I taking it? I want to know what the side effects is. I want to know how long I have to take it. Those are questions that I ask my primary. Do y'all do the same?
Helen, they only tried to prescribe cholesterol medicine to me within the last 4 years of my blood work. The last 2 years I brought it down. I took milk tinsel and red yeast rice. And this year it went up a little bit, but I knew I wasn't doing some of the things I had been doing in the past. So I don't never take medicine. If it's not, I just
Okay.
refuse it.
Okay. Why don't you like taking prescription meds, Jackie?
If I'm sick enough to take an antibiotic or something like that, or something for a cold, I have taken medicine for that. But that's
Okay.
a short-term thing.
Okay.
I don't have to take it, but I'm not going to get. I'm trying to be like my grandmother. My grandmother lived to be 87 years old. Toward the end of her life, she got Alzheimer's the last 4 years, but she wasn't on no medicine. No diabetic medicine, no cholesterol, no high blood pressure. I
Now,
think I do it too.
because you said that, Jackie, hopefully, is your grandma still with us?
No, she's deceased. She died
Okay.
she died in 90 something, but she was 86 years, 87, 86, something like that.
Did you ever ask her, because people that live to that age, that's history. Did you ever ask her, what did she do that contributed to her long life of longevity?
I know what she did because she raised me. She
Okay.
didn't how to overeat her. She didn't eat a lot. She moved a lot. Because I can compare her to my other grandmother. My other grandmother overate and she had diabetes and kidney failure and stuff. I compared the two. As I got older, I began to compare the situation.
Okay.
That's
Okay.
what I've compared it. And
Okay.
that grandmother, the stuff was not hereditary, like they say. That was just wrong eating. So everybody ate like her, they had the same thing, diabetes and stuff. My grandmother just wasn't an overeater. And we had gardens and stuff.
Mm-hmm.
That's what I'm saying. We had gardens and stuff. Like now, because y'all ever heard of bay leaves?
Yes.
Yeah, my grandfather worked for a construction company. That's a lot of digging he done. And sometime I remember I was in elementary school. If he would kind of twist his arm the wrong way, or it would be hurting him, he would send me out there to get bay leaves off the tree. And he would wrap his arm with bay leaves. And he would wrap it up and go to bed that night. And see, the next day, he never missed a work. He went on to work. Never went to the doctor for nothing, like no twisting arm or nothing. So that's why I said it grew the stuff. It grew. They used natural stuff. They didn't.
Thank you for sharing that, Jackie.
You're welcome.
Thank you. Thank you. Last one, potential conflicts of interest. Potential conflicts of interest, meaning, you have influences from the pharmaceutical companies and healthcare funding sources that shape the treatment and recommendations and priorities in conventional medicine. The pharmaceutical companies and the funding is big when it comes to these prescription medications. The limitations of it is that it can lead to overemphasis on pharmaceutical interventions at the expense of exploring natural remedies or lifestyle modifications that could benefit patients. It's all about the patients or the clients. So we're going to recap. We talked about the importance of prevention, proactive health management, long-term health benefits, the role of natural medicine, holistic and integration and empowerment, hidden aspects of conventional approaches focus on symptoms versus the root causes, potential conflicts of interest, neglect of lifestyle factors. What is the one key takeaway or insight you gained from today's webinar that you plan to apply to your health and wellness journey? Regina.
Definitely looking at more of the herbs to help. And but definitely you're definitely on key with checking with any medications I'm currently taking to see if there's any type of side effects or contraindications. But definitely looking into more herbs and incorporating that into the lifestyle.
Awesome. That's awesome, Regina. Jackie, what did you get out of it?
I think be more proactive because, like I said, I know what I didn't do, so I need to give it another shot. And yeah, the 4 that you suggested, the top 4, I think I need to make sure I have those on hand, which I think I have all of them except the inexuation. That one I don't have that one.
Okay, the echinacea.
The echinacea that comes in a pill, or that comes in a
It
powder?
comes in a pill and it also comes as a tea.
Okay.
It comes in a pill form, but it also comes as a tea. I would suggest the tea only because when you take any liquid, it saturates more quickly into your bloodstream and into your body quicker than a pill would.
Okay.
Dr. J.
Yes. Definitely looking more like, so looking at more herbs. Like I definitely have the ones that I'm like, oh, okay, like these are my go-to. But I must admit, echinacea is not one, like I know it's a very common one, but that's not one that I'm used to. And then I know they're actually, like you brought back to my mind, like St. John's wort and stuff like that. So just doing more research and doing more, like just continuing with the herbal remedies and trying to steer clear of allopathic medicines.
We working on it, Dr. J. We getting there. We getting there. Just gotta enlighten the people. So it's time. Option 1 person says, I'm interested in a one-on-one 30-minute consultation. It's $39 for today, anybody that attended. Or option 2 is, I'm interested in purchasing the book, Unlocking Natural Medicine, A Comprehensive Guide to Preventive Healthcare. That is also $39 for attendees. Or you could be option 3 person. I found the presentation engaging and informative. However, I am not interested in the consultation or the book. If you are option 3, I say to you, come back next week or share the information that you got here with someone else, because next week I will be doing a presentation on topic holistic healing through essential oils. And I will put the post out there so that you can register if you're interested in attending that webinar, Holistic Healing Through Essential Oils. It's all a part of natural medicine. Essential oils are therapeutic. They are medicinal, and they do have medicinal properties. It's not just for relaxation. You have essential oils that you can take for a headache. Something so simple as a headache. So I will be doing that next Thursday, October 3rd. Invite once you see the register link, register and invite if you got some benefit out of today. And I'd like to say thank you. I appreciate y'all ear. I appreciate y'all giving me your time. I appreciate the engagement. I highly appreciate it. And I say thank you for all of that. And I'm going to stop my share. Hi, everybody.
Hi.
I'm here. And then I'm
Okay.
going to stop the recording